So today, I'm going to say what most doctors are too uncomfortable to say. Because you deserve honesty. You deserve to understand what is actually happening inside your body right now. And you deserve to know that what you've been doing privately, possibly in silence, possibly with shame, is not only normal. When done correctly, it may be one of the single most important things you can do for your health after 60. Stay with me, because what I'm about to share has the power to change everything. Now, before anything else, let me tell you exactly who I am and why you should listen to what I'm about to say. My name is Dr. Nerita. I am a board-certified urologist. That means I am a fully trained medical doctor who spent years in surgical and clinical training specializing in the urinary tract and the male reproductive system, the prostate, the bladder, erectile function, hormonal changes, and everything that affects a man's body as he ages. I have been practicing urology for over 12 years. 12 years of sitting across from real men in their 60s, their 70s, their 80s, who walked into my clinic quietly frustrated, quietly embarrassed, and almost always quietly convinced that whatever they were experiencing was simply part of getting old and there was nothing left to do about it. In almost every single case, they were wrong. Not because their bodies had given up on them, not because the damage was irreversible, but because they had never, not once, been given the right information. They had spent decades with habits that worked perfectly well at 30, but were now silently working against them at 65, and nobody had ever told them it was time to adjust. That is the entire reason I make these videos. No shame, no judgment, no vague medical language designed to keep you confused. Just honest, practical information, the same conversation I have with men inside my clinic every single week. You are in good hands. I promise you that. Now, if you have never had a conversation this honest about your health before, hit that like button right now. It tells me you're ready to stop guessing and start understanding your own body. Drop a comment below and tell me, where in the world are you watching from? I genuinely read every single one, and I love seeing this community of men from all over the globe showing up for themselves. And if you are new here, please subscribe, because every single week I bring you the real conversations about men's health that your doctor should be having with you but probably isn't. Now, let's get into it. Before we get to the 3 mistakes, I need to address something important, because there is a myth, a stubborn, deeply harmful myth that far too many men your age have quietly accepted as fact. The myth says that somewhere around 60, desire is supposed to fade, that the body sends a quiet internal signal saying your time for this has passed, that wanting physical pleasure at this stage of life is somehow undignified or embarrassing or a sign that something is off with you. I need you to hear me clearly. That myth is medically false, and it is doing real, measurable damage to men's health every single day. The truth is, your body does not stop needing this. What changes is simply how it needs it. After 60, regular, gentle self-stimulation does something remarkable inside your body. It keeps oxygenated blood circulating through penile tissue, and this is not just about pleasure. This is about preservation, keeping that tissue alive, elastic, and functional. It supports your prostate by flushing out stagnant fluid that builds up over time and causes discomfort. It lowers cortisol, the stress hormone that silently attacks your heart, your sleep, and your immune system. And it triggers dopamine, the chemical that makes you feel grounded, calm, and genuinely alive. This is not a luxury. This is maintenance. The same category as your evening walk, your medication, your diet. But here is the part that nobody ever warns men about. The way you have been approaching this since your 20s and 30s, that same approach, unchanged, unexamined, may now be actively working against your body. And that gap between what your body needs now and what you have always done is exactly where the silent damage quietly begins. Mistake number 3, treating this like something you need to get out of the way. Let me ask you something honest. When was the last time you were truly unhurried during a private moment? Not watching the clock, not thinking about what comes next, not in a quiet internal hurry to just finish and move on? If you had to pause to think about that this section is directly for you, here is what rush does to a body over 60 biologically. When you are tense, when there is urgency underneath the surface, your nervous system reads that as a threat. It activates the sympathetic response, what we call fight or flight. And in fight or flight mode, your blood vessels do not expand and relax. They constrict. Blood does not flow freely into the tissue that needs it. Your muscles don't soften. Your nerve endings don't fully open up. You are essentially asking your body to respond while it is physically braced for danger. And over months and years of this repeated pattern, your body begins to associate touch with tension rather than safety. Erections feel less reliable. Sensation feels duller and harder to reach. And you start to quietly wonder if something is permanently wrong with you. Nothing is permanently wrong with you. You have simply been rushing. The fix sounds almost too simple. Slow down. Give yourself 5 extra minutes. And before you begin, breathe. Not metaphorically, actually breathe. Long, slow, deliberate breaths that send a clear message to your nervous system. We are safe. We can relax. We can let blood move freely. The difference in how your body responds to that one small shift will genuinely surprise you. Mistake number 2, using force where your body now needs finesse. As sensitivity naturally decreases with age, and it does decrease, this is completely normal physiology. Many men instinctively compensate. They grip harder, move faster, apply more pressure because the lighter touch no longer seems to register the way it once did. The logic makes complete sense, but here is what that pressure is actually doing inside the tissue. The penis contains layers of spongy erectile chambers that fill with blood to create an erection. That tissue, like all tissue in an aging body, becomes more vulnerable to trauma over time, not less, more. Aggressive, high-pressure stimulation creates what we call microtrauma, tiny internal injuries you cannot feel in the moment. But over time, scar tissue gradually begins replacing healthy erectile tissue. The nerves that should be transmitting pleasure become progressively desensitized instead. There is even a clinical pattern I see regularly from this, where a man's body becomes so conditioned to intense, specific stimulation that normal, gentle touch stops producing any response at all. Intimacy with a partner becomes frustrating and confusing, and the man sitting in front of me has genuinely no idea why his body has stopped cooperating. The solution is the opposite of what feels intuitive. Go lighter, deliberately lighter than you think you need to. Use a fragrance-free, natural lubricant, not just for comfort, but as actual tissue care. Let sensation come to you rather than forcing it. Think of this not as chasing a result, but as therapeutic care for an organ that is working hard to serve you every single day. Give it gentleness. It will give you back far more than force ever did. And mistake number 1, the one that silently undoes everything else, carrying shame into the room with you. This one is not physical, but it is the most powerful of all 3. Here is something most men have genuinely never been told. Your emotional state during private moments is not separate from your physical response. It is directly, biologically wired into it. When you enter this experience carrying guilt, old religious messaging, social conditioning, the quiet internal voice that says you are too old for this is embarrassing, what would people think? Your body responds to that shame the exact same way it responds to physical danger. Cortisol floods your system. Your pelvic floor muscles contract and tighten. The very muscles that need to be soft and open for healthy blood flow lock up instead. And your brain, rather than releasing dopamine, releases stress hormones. The experience that should feel restorative feels hollow, mechanical. Sometimes it feels worse than before you even started. And so men stop entirely. They avoid it. And when they stop, the blood stops moving through the tissue. The prostate fluid builds up. Sensitivity fades further and faster. And 6 months later, they are sitting across from me in my clinic, wondering why their erectile function has declined so sharply, so suddenly. The shame did not protect them. The shame accelerated the exact decline they feared. So let me say this to you directly. As your doctor, as someone with 12 years in this field, as someone who has had this conversation more times than I can count, you have nothing to be ashamed of. This is your body. This is your health. You are not doing anything wrong. You are doing something your body genuinely needs. Give yourself permission. Not just to do it, but to do it with care, with self-respect, and with the full understanding that you are tending to something that deserves your compassionate, unhurried attention. Practical action plan I want you to do starting today. So, what does this actually look like in practice? Let me give you something concrete. Start by creating the right conditions. Clean hands, a quiet, private space, and absolutely no time pressure. Not stolen minutes between responsibilities. Real, intentional space that you give yourself without apology. Begin with breath. Before anything else, 3 slow, deep breaths. You are signaling to your entire nervous system that this is safety, not urgency. That shift alone changes everything that follows. Use lubrication. Fragrance-free, natural, water-based. Apply it generously and without hesitation. This is not optional comfort. This is tissue protection. Begin lighter than you think you need to. Start with sensation, not stimulation. Let your body warm up slowly and at its own pace, the way any muscle needs time before it can perform. Stay present. If your mind drifts toward guilt, toward worry, toward the noise of daily life gently, without criticism, bring it back. Remind yourself quietly, this is healthy. This is care. I am allowed to be here. Finish gently. Clean up with warm water. Take 1 slow breath before you move on. Treat the ending with the same intentionality as the beginning. Done this way consistently, patiently, without shame, this becomes medicine. For your prostate, for your circulation, for your confidence, for your relationship, for your mind. I want to close with something I say to nearly every man who sits across from me in my clinic. You are not broken. If your body is responding differently than it used to, that is not failure. That is not your body giving up on you. That is your body communicating, asking you to update your approach, asking you to pay closer attention, asking you to meet it where it actually is right now rather than where it was 30 years ago. And there is something genuinely beautiful in that. At 60, at 70, even at 80, your body is still talking to you, still asking for care, still capable of responding when you give it what it actually needs. The men I have watched completely transform their health were not men who found a miracle solution. They were men who stopped rushing, who learned to be gentle, who gave themselves permission to care about this without shame or embarrassment. That transformation is available to you right now, starting tonight. Age is not the end of vitality. Let me say that one more time, because I need you to believe it before you close this video. Age is not the end of vitality